Let me ask you something, and be honest with yourself. How many times did you wake up last night to use the bathroom? Once? Twice? Maybe 3 or 4 times. If you're over 60 and you're getting up one or more times every single night to pee, you are not alone. In fact, a major study published in the Journal of Urology found that over 77% of adults over the age of 60 experience this exact problem. And for many of you watching right now, it's been going on for years. But here's what's alarming, and this is why I made this video. Most people think this is just aging. They think, I'm getting older, this is what happens. So they accept it. They shuffle to the bathroom at 2 a.m. They lie awake for an hour trying to get back to sleep. They wake up exhausted. And day after day, year after year, they just cope. But what if I told you that one common habit, something millions of people do every single evening without even thinking about it, is making this problem dramatically worse? And what if stopping that one thing could cut your nighttime bathroom trips in half? Today, we're going to talk about exactly that. I'm going to tell you what that habit is, explain the science behind why it's wrecking your sleep, and walk you through what doctors actually recommend instead. So if you're tired, literally tired, of waking up in the dark to use the bathroom, stay with me. Because by the end of this video, you're going to have a real plan. First, let's give this problem its proper name, nocturia. It simply means waking up from sleep one or more times during the night to urinate. Now you might think, okay, that sounds minor. A bit of an inconvenience. But here's what the research actually shows, and this is serious. A landmark study from Johns Hopkins University found that people with nocturia have a significantly higher risk of falls and fractures, particularly hip fractures, because they're getting up groggy, in the dark, often disoriented. In adults over 70, a hip fracture can be life-threatening. But the damage goes even deeper than that. The Sleep Medicine Review's journal published findings showing that disrupted nighttime sleep from nocturia is directly linked to depression, cognitive decline, high blood pressure, and even increased risk of cardiovascular disease. Think about what's happening. Every time you wake up to use the bathroom, your body jolts out of deep, restorative sleep, the kind your brain absolutely needs to clear toxins, consolidate memory, and repair itself. Do that night after night for years, and the cumulative health cost is enormous. So nocturia is not just annoying. It is a genuine medical concern that deserves real attention. Before we go further, I want to know, how many times are you getting up at night? Drop it in the comments below. Type 1 time, 2 times, 3 or more, whatever it is for you. No judgment here. You'd be surprised how many people watching this video right now are going through the exact same thing. Let's hear from you. Okay, so why does nocturia tend to get worse as we get older? There are a few key reasons, and understanding them is going to make the solution make a lot more sense. Reason number 1, your body makes less of a key hormone. Your body produces something called ADH, antidiuretic hormone. Don't worry about the name. All you need to know is that this hormone tells your kidneys to slow down urine production at night so you can sleep undisturbed. When you're young, your body pumps out plenty of this hormone at night. But as you age, production naturally declines. So instead of your kidneys slowing down while you sleep, they keep producing urine at nearly the same rate as during the day. The result? Your bladder fills up faster. You wake up more. Reason number 2, your bladder capacity decreases. As we age, the bladder muscle can become less flexible. It holds less before sending the urgent signal to your brain. So even a moderate amount of urine can feel like an emergency. Reason number 3, medications. Many common medications taken by adults over 60, including blood pressure drugs called diuretics, certain antidepressants, and even some heart medications are well known to increase urine production. If you're taking any of these, they may be contributing more than you realize. Always talk to your doctor before changing any medication, but it's worth the conversation. Reason number 4, underlying health conditions. Conditions like diabetes, heart disease, sleep apnea, and prostate enlargement in men can all contribute to nocturia. If you haven't discussed your nighttime bathroom frequency with your doctor, that conversation is overdue. But here's the thing, even with all of these factors at play, there is one behavioral habit that is so commonly overlooked, and it's making all of these problems worse. And that one thing is what and how much you drink in the hours before bed. Here it is. The one thing doctors want you to stop doing before bed if you struggle with nocturia: drinking large amounts of fluid, especially certain types of fluid, in the 2 to 3 hours before you go to sleep. Now, before you say, I already knew that, I want you to hear me out. Because the research shows most people are dramatically underestimating how much they're drinking in the evening, what they're drinking, and exactly how early they need to stop. A clinical study published in Neurourology and Urodynamics found that reducing evening fluid intake was one of the single most effective non-medication interventions for reducing nocturia. Patients who practiced proper fluid timing saw a reduction of up to 1 or 2 bathroom trips per night without any drugs, without surgery, just by changing when they drank. Let's break this down properly. The 2 to 3 hour rule: doctors generally recommend cutting back on fluids about 2 to 3 hours before bedtime. That means if you go to bed at 10 p.m., you should be tapering your fluid intake after 7 or 7:30 p.m. and consuming very little after 8 p.m. Most people are still drinking tea, water, juice, or other beverages right up until they brush their teeth and get into bed. That fluid has to go somewhere. Your kidneys don't care that you're trying to sleep. They process that liquid and send it to your bladder, typically within 1 to 3 hours. It's not just about how much, it's about what. This is the part that surprises most people. Not all drinks affect your bladder equally. Some beverages are what's called diuretics. They actively make your kidneys produce more urine than the liquid you consumed. And many seniors are drinking them every evening without realizing the impact. The biggest culprits: red circle coffee and tea. Caffeine is a powerful diuretic. Even decaf contains small amounts that can irritate a sensitive bladder. Many people have a cup of tea at 8 p.m. as a relaxing bedtime ritual, and they wonder why they're up at midnight. This is why. Red circle alcohol, this one is critical. Alcohol suppresses the very hormone we talked about earlier, ADH, the one that tells your kidneys to slow urine production at night. A single glass of wine or beer in the evening can mean 2 or 3 extra trips to the bathroom overnight. Research published in Alcohol and Alcoholism confirmed this direct connection. Red Circle sparkling water and sodas, the carbonation can irritate the bladder lining, making it feel fuller sooner and more urgently than it actually is. Red Circle citrus juices, orange juice, grapefruit juice, and lemonade are highly acidic and known bladder irritants. Evening consumption can increase urgency significantly. I want to stop here and ask you something important. Which of these drinks do you regularly have in the evening? Coffee? Tea? Glass of wine? Sparkling water? Comment below and tell me. I read your comments, and your answers also help other viewers realize they're not alone. So be honest, which evening drinks are you having that might be making this worse? But what about staying hydrated? I know what some of you are thinking. But doctor, I've always heard I need to drink 8 glasses of water a day. If I stop drinking early, won't I get dehydrated? This is such an important question. And the answer is front-load your fluids. The goal is not to drink less overall. Hydration is genuinely important, especially as we age, because the thirst sensation becomes less reliable after 60. Dehydration in older adults increases the risk of kidney stones, urinary tract infections, and confusion. The key is timing. Drink most of your water and other fluids in the morning and early afternoon. Have a normal amount at dinner. Then taper off after 7 p.m. Your kidneys will have already processed most of that fluid long before you get into bed. This simple shift in timing, without reducing your total daily fluid intake, is enough to make a significant difference for many people. Changing your evening fluid habits is the single most impactful step, but there's a complete picture here. Let me walk you through several other evidence-backed strategies that urologists and sleep doctors recommend. Strategy number 1. Elevate your legs in the afternoon. This one sounds unusual, but the science is solid. When you sit or stand for most of the day, fluid from your blood gradually pools in your lower legs and ankles. This is especially common in older adults and those with mild heart conditions or poor circulation. You may notice it as mild swelling or puffiness by the end of the day. Here's the problem. When you lie down at night, that pooled fluid gets reabsorbed into your bloodstream, your kidneys process it, and your bladder fills, usually between 12 a.m. and 3 a.m. That's often exactly when you wake up. The fix? Spend 30 to 60 minutes in the late afternoon with your legs elevated, feet up on a footrest or pillow, above the level of your heart. This allows the fluid to drain before bedtime, so your kidneys handle it while you're still awake rather than at 2 in the morning. A study in the Journal of Urology found this intervention meaningfully reduced nocturia frequency in patients with fluid retention. Strategy number 2. Limit salt, especially at dinner. High sodium intake causes your body to retain water and then release it later when you're trying to sleep. A diet high in salt, particularly at your evening meal, can contribute significantly to overnight urine production. Reducing your sodium intake, especially cutting back on salty snacks, processed foods, and restaurant meals in the evening, is a straightforward intervention that supports better bladder control at night. Strategy number 3, try a double void before bed. This is a technique urologists recommend. Go to the bathroom as part of your normal bedtime routine. Then wait 5 to 10 minutes and try to urinate again. This second attempt often empties the bladder more completely, giving you a longer head start before it fills again. Simple, but research confirms it helps reduce the urgency that wakes people in that first hour or two of sleep. Strategy number 4, talk to your doctor about timing your diuretic medications. If you take a blood pressure medication that is a diuretic, a water pill, and you take it in the evening, ask your doctor about switching to a morning dose. For many patients, this one timing shift eliminates 1 or 2 nighttime bathroom trips completely. Your doctor can advise whether this change is safe for your specific situation. Strategy number 5, get evaluated for sleep apnea. This one surprises people. Research has established a clear connection between obstructive sleep apnea, a condition where breathing stops briefly during sleep, and nocturia. When breathing is obstructed during sleep, pressure changes in the chest cause the heart to release hormones that signal the kidneys to produce more urine. Treating sleep apnea, often with a CPAP machine, has been shown in multiple studies to significantly reduce nighttime urination. If you snore, feel tired despite sleeping, or frequently wake up gasping, sleep apnea should be investigated. Here's something I genuinely want to know. Have you ever tried any of these strategies? Did anything work or not work? Share your experience in the comments. Your real-life story might be exactly what another viewer needs to hear. And if you have questions about any of these strategies, drop them below. I may address them in a future video. Now, I want to be clear about something important. While behavioral changes can make an enormous difference for many people, nocturia can also be a symptom of something that needs medical attention. Please talk to your doctor if you're waking up 3 or more times per night to urinate, you're experiencing pain, burning, or blood in your urine, the problem has come on suddenly or gotten rapidly worse, you notice significant swelling in your legs and ankles, you're excessively thirsty during the day alongside frequent urination at night. This can be a sign of uncontrolled diabetes. Men specifically should discuss nocturia with their doctor, as prostate enlargement is one of the most common and treatable causes of nighttime urination in men over 60. For women, pelvic floor weakness after childbirth or menopause can contribute significantly to bladder urgency and frequency, and pelvic floor physical therapy has strong evidence behind it as an effective treatment. The bottom line, self-care steps are a great starting point, but they work best alongside, not instead of, proper medical evaluation. All right, let's bring it all together. If you're waking up to pee at night and you're over 60, here's your action plan starting tonight. White heavy checkmark, stop drinking large amounts of fluid 2 to 3 hours before bed, especially coffee, tea, alcohol, soda, and citrus juices in the evening. White heavy checkmark, front load your hydration. Drink most of your water in the morning and afternoon. White heavy checkmark, elevate your legs for 30 to 60 minutes in the late afternoon to prevent fluid from pooling. White heavy checkmark, reduce salt at dinner, especially processed and restaurant food in the evening. White heavy checkmark, try a double void before bed to more fully empty your bladder. White heavy checkmark, talk to your doctor about medication timing, sleep apnea screening, and whether anything else might be contributing. You don't have to accept broken, exhausted sleep as a permanent part of getting older. These strategies are backed by research. They are practical. And for many people, they genuinely work. Start with the evening fluid change tonight. Just tonight. See how you feel tomorrow morning. If this video helped you, please give it a thumbs up. It helps other seniors who need this information actually find it. And subscribe if you haven't already, because every week I'm bringing you practical, doctor-backed information to help you live better, longer. And one more time, drop a comment below. Tell me, how many times are you waking up at night? Have you tried any of these strategies? What questions do you still have? I read every single comment. And I will see you in the next video. Take care of yourselves.